The Hamilton C1 is a versatile, high performance mechanical ventilator designed for use in various clinical settings, including ICU, emergency transport, and neonatal care. It supports ventilation for adults, pediatric patients, and neonates. It has adaptive ventilation technology that adjusts parameters based on patient needs, reducing the risk of ventilator induced lung injury. It's known for its portability, compact design, and battery operation, which makes it ideal for use in emergency and transport situations. It provides real time lung mechanic data, ensuring better decision making for respiratory therapists. Here are the main components of the Hamilton C1. It has an integrated monitor with touchscreen display and alarm system. It has a ventilation unit for gas mixing and control, patient breathing circuit for gas delivery and exchange, oxygen monitoring using galvanic sensor, optional communication with smartphones through hospital network, and optional connections to humidifiers, nebulizers, SpO2 and CO2 sensors, and external data interfaces. The Hamilton C1 can provide invasive or non-invasive ventilation to treat ARDS, COPD, neuromuscular disorders, or for post-surgical recovery. It can also be used on patients with acute respiratory failure. It can provide high flow oxygen therapy to treat hypoxemia or post extubation respiratory support. And it can also be used on neonatal patients requiring precise low tidal volume and leak compensation. Here are the steps for the circuit setup. First, we must install the expiratory valve and select the appropriate breathing circuit and components. To assemble the breathing circuit, we must connect the inspiratory and expiratory limbs to the designated ports and attach the patient interface. We must ensure there's proper humidifications and filtering in place and perform a system leak to ensure that all connections are tight and secure. We must then adjust the position of the breathing circuit, connect the external devices and sensors, and perform required tests, calibrations, and pre-operational checks. The flow sensor and circuit calibration are performed after connecting a new breathing circuit or before patient use. The purpose is to check and reset calibration points and measure circuit resistance. The calibration involves three components: the flow sensor, the component in breathing circuit following the flow sensor, and the calibration adapter. The ventilator will prompt when an oxygen sensor calibration is required, in which it's exposed to room air and 100% oxygen for proper calibration. There are various safety tests incorporated into the Hamilton C1 to ensure that the ventilator operates safely and delivers effective respiratory support. During the ventilator setup, the Hamilton C1 performs a self check that also verifies proper alarm function, including generation of an audible alarm sound. It also confirms functionality of sensors and valves. If the self test fails, we must restart the device. If the problem persists, have the ventilator serviced. If the device enters the ambient state in which it stops ventilating, provide alternative ventilation and have the ventilator serviced. Always ensure to have manual ventilation backup in case of failure. Here are a list of alarms for the Hamilton C1. This chart includes adjustable alarm priority, range for adult peds and neo, defaults for adult peds and neo, and resolution. Alarms can be set for parameters including pressure, volume, flow, oxygen concentration, and respiratory rate. Users can adjust alarm limits based on patient needs and clinical conditions.
In NCPAP mode, the only setting that needs to be set is the CPAP. Flow will automatically be adjusted based on the patient's condition and leakage variation. This feature helps to prevent high peak pressure and allows for efficient leak compensation. CPAP is delivered via a nasal interface. In biphasic NCPAP pressure control, the clinician sets two pressure levels, a respiratory rate and the inspiratory time, and can adjust the flow as needed. This mode still allows the baby to take spontaneous breaths at both pressure levels while also delivering mandatory breaths. The Hamilton C1 can also deliver high flow with heated humidification. After changing the interface, the same device and circuit can be used as the CPAP modes, so therapy can be quickly switched to high flow. This therapy reduces the risk of atelectasis and pneumothorax, shows improved oxygenation and ventilation perfusion ratio, improves mucociliary clearance, and secretion clearance. Some specific neonatal ventilation considerations for the Hamilton C1 include that it is able to deliver tidal volumes as low as 2 milliliters for lung protection for the smallest premature neonates, has a proximal flow sensor designed for neonates to measure pressure, volume, and flow at the airway to determine the optimal trigger sensitivity. This allows for a lower work of breathing. It has a specifically designed neonatal expiratory valve, has leak compensation and synchronization with the use of uncuffed tubes. It has a detachable humidifier extension that can be used in incubators, has soft material nasal prongs to reduce nasal trauma, and it has low noise levels. One of the unique features of the Hamilton C1 is its dynamic lung panel display, which shows a visual representation of the patient's lung. It shows airway resistance, lung compliance, and synchrony. This feature is not available in the neonatal mode, but it is available in the pediatric mode. Another unique feature of the Hamilton C1 is the IntelliTrig leak compensation. Leak is measured at the airway opening by comparing inspiratory and expiratory volume. The data obtained here will be used to automatically adjust gas delivery to promote synchronization with the baby's breathing and reduce auto-triggering. This feature is available in both the invasive and non-invasive modes. One of the challenges that Hamilton has faced is that the Hamilton C1 and 3 other Hamilton models were recalled in 2023 because of a software issue that caused the ventilator to go into an ambient state and stop ventilating. The FDA recalled over 21,000 Hamilton ventilators made from 2010 to 2023, classifying them as a Type 1 recall, with the potential to cause serious injury or death.
All right, so now we're going to look at adjustments to optimize ventilation. So this is our first scenario. So we have a patient that comes into the ER. She is a 35-year-old female with severe COPD exacerbation. Her vitals are as follows: SpO2 of 89%, respiratory rate of 23, heart rate of 122 beats per minute. And now we're going to look at the ventilator settings. So with the Hamilton, we are going to put this in non-invasive mode via BiPAP. And in this mode, we're given IPAP, and we also are given EPAP. So IPAP, this tends to blow off CO2, and this is also going to help with the work of breathing that she may be experiencing. So I would set this to about 12 centimeters to 15 centimeters. And her EPAP between 4 and 6 centimeters. EPAP is also known as PEEP. So this is going to overall improve her oxygenation. And then next, FiO2. We're going to want to set this at 50% just to get her SpO2 up. It is quite low at 89. So you want to get that up to at least 90 to 92%. And we also don't want to go too high with the FiO2 because people with severe COPD do tend to retain more CO2. So we're just going to keep that at that range. And overall, these settings should help increase overall oxygenation in the patient and also bring those vitals down. So, help bring her respiratory rate down as well as heart rate. So, these are the parameters and settings I would put into the Hamilton in this scenario. All right, so in our second scenario here, we have a 3-day-old baby with RDS weighing in at 4.2 kilograms, and vitals are an SpO2 of 85%, respiratory rate of 70, heart rate of 160, and temperature of 36.5 Celsius. So the SpO2 is quite low. Respiratory rate is also quite high, and heart rate is normal to the high range for a neonate, and temperature is normal. So, our goals here with the Hamilton ventilator is we overall want to use non-invasive ventilation, and we want to reduce overall work of breathing and improve oxygenation. And our biggest thing is we want to avoid intubation if possible. So these are the settings that I would set on the Hamilton. The mode would be CPAP, I would select. And a great thing with these is that we have a neonate mode. So this is wonderful for babies. So we would select that. And we're also going to want to keep our PEEP around 5 centimeters and our FiO2 at 50. Just like the case before, we don't want to go too high, but around 50 is a good starting range. And we want to see that SpO2 get upwards of 90% or more. And we also want the flow around 7 liters per minute, I would say. And overall, another important thing is humidification. So in babies, this is essential to protect airway mucosa and optimize secretion clearance. So we're definitely going to use humidification in this case to help. Okay, next we're going to look at how the Hamilton C1 compares to the Hamilton C6. So this was wonderful. This was right on the Hamilton website. You were able to compare various different models. And in this case, I picked the Hamilton C6 to compare with the Hamilton C1. So this table was provided on that same site. So as we can see, volume controlled, flow controlled is not provided on the Hamilton C1, but is on the Hamilton C6. Volume targeted adaptive pressure controlled is available on both. Intelligent ventilation is an option for both of these. Again, non-invasive ventilation, of course, is available for both of these, but it is standard for the Hamilton C6. High flow is also an option for both. And as we go into advanced monitoring, visualization of lung mechanics. So the dynamic lung, as we can see on the display here, is viewable, and visualization of patients' ventilator dependence also is something we can see. So that's super important that we're able to see that as respiratory therapists just to monitor the patient. Now, something that the Hamilton C1 does not have, that the Hamilton C6 does, is esophageal pressure measurement. So Hamilton C6, as we'll see in the next slide, is a little bit more in depth. So it has some extra little features like that the Hamilton C1 doesn't. Capnography is an option on both of these as well. And some other ventilation features, recruitability assessment and lung recruitment. That is not an option on the Hamilton C1, but we see that on the Hamilton C6. We also see patient ventilator synchronization as an option on Hamilton C6, but not on Hamilton C1. And then CPR ventilation and Hamilton Connect module is an option for both of these. All right, so now we're going to just take a look at the unique advantages of both of these machines, as well as some limitations. So some unique advantages to the Hamilton C1 is that it is extremely portable, it is lightweight, often used by transport teams, ER we see it in, the NICU, and it also has a high performance turbine. And also, I didn't mention it in here, but I did want to mention that it did state that it is quiet. So because of its size, it is a very quiet machine. And it has peak flow of about 260 liters per minute. Some unique advantages to the Hamilton C6 would be that it has a large screen, as we could see in the previous slide. And I found this really interesting that it had the option for 2-patient setup. So it mentioned on the site that this could help with utilizing more ventilators for more patients. So I've never seen this done before, but I think that is quite a neat feature it has. Next, it has more advanced waveforms, customizable layout, and intelligent ventilation. Some limitations of the Hamilton C1 would be that it has more basic trends, loops, and waveforms. Um, so, again, it has everything that you would need, say, in the ER or NICU, but it did mention the Hamilton C6 is more for intense cases in the ICU, or it also could be for surgeries, or it could be especially good for teaching. Whereas the Hamilton C1 is more basic, and that is the biggest difference. So, limitations of the Hamilton C6 would be it is not as portable, it is definitely heavier, more expensive, and the battery life is 2 to 4 hours. So, again, not super portable. You want it near a power source. Okay, great. So, some consumables required for the Hamilton C1 would be a breathing circuit set. So, in this particular picture, we have a dual limb. So, this is definitely required. And next, we have a flow sensor. So on the catalog on the website, it had various flow sensors. They range between 160 centimeters to 330 centimeters. We also have an expiratory valve. And next, we have a filter. So, again, these are all consumables that are required for the ventilator.